to that time, I thought, oh, is it right to give needles so in pregnancy? But it was a question of yeah, of my old education in acupuncture. So we started with our nurses, midwife, and with my colleagues and social workers. But we gave from the beginning all the 5 points and in pregnancy. And there are no points what you can't give in pregnancy. At any time in the pregnancy, you can start with this.
Well, for me, once they had acupuncture, they were able to listen more and realize what was going on around them. I called it corrective criticism, but you could see it in their face that they understood now what everything was about, what they needed to do to have their child with them, to have a clean baby. I tell them, if you got to me by the time you were 7 months pregnant, I can guarantee you a drug-free baby. A lot of them were connected to family court, child services, all kinds of agencies that were monitoring them because, of course, they were in the street, most of them. And it just made them more aware. One of the judges came to my program, and she stayed around all afternoon. She said the people that came in front, rather the women that came in front of her were more calmer. They understood what she was talking about. They seemed more friendly. They just had a better countenance, you know. And when she came to the program, she said, I can't understand how it's so calm and quiet here. You have drug-addicted women, also alcohol women. I just said, hey, look around. We give out a lot of TLC, and acupuncture takes away the want to get high. It brings you centered. It makes you calm yourself. And that's what you need when you're raising children, especially when you're pregnant. Good Lord, have mercy. But that's what I took from it. It centered my women, made them calmer, made them easier to deal with, and it made it easier for them to deal whatever outside was going on that they had to handle along with these children.
Ralph, any comments from you?
Yeah. So just when we saw them the first times, and so we do an ultrasound, of course, so then they can see that the baby is looking normal. But the more is when they get the first times acupuncture, also in a group, they were more concentrated, more alive, and they can more do their jobs from a pregnant woman. Also to have consultation, and so they were more, how to say, equilibrated or more relaxed in a way. Yes, and that was also good for the pregnancy. They could feel more their babies. So when they were 20 weeks or 25 weeks, they were more aware, alert. Okay. And of course, after that, when the baby were born, so not a lot of them took methadone all during the pregnancy, because we treated all who want acupuncture or other women who refuse it, acupuncture. But the most wanted it. And the more and the longer, so we would say, the better the effect on the baby. And so a lot of baby had no withdrawal after, typical is after 3-4 days or 5 days withdrawal on a newborn. That is a terrible experience, also for the nurses. But that was we were astonished about that, and it was not necessary. We saw that they came really every day. There were a lot of young pregnant ladies, they came twice a week or 3 times, or from time to time only a week once or twice. And there were a lot of very good effects to the baby. Okay. And also to the family. They brought the people from the family also with them. And they can get also some needles. Okay.
Well, speaking of good effects, it makes me wonder if any time either of you experienced some sort of a negative experience with the protocol or the services, that something kind of went in a way that you didn't expect.
No, never. It was so good. They would go out and get pregnant to come back in the program again. That was my problem. I couldn't get rid of them after I so-called fixed them. And I look up, and here they're coming through the door again. What are you doing back here? Oh, Miss Smalls, you can't put me out. I'm pregnant again. So I would say no. Everything went very well.
Yeah, no, the same. I never saw an adverse effect. So I never saw any complications, what I could imagine that it is connected to acupuncture. Never.
Right.
And it is more, I was astonished about the acceptance to get needles and nothing more, some sticks in the air. So, and that they came again and again, and they wanted it, and they were not asked from me or from the staff, how are you and is it good or so, anything like that. But they brought flowers from time to time, or they said, oh, thank you. It's a good idea. And so it was for us also good to hear some things like that. But any complications, never.
Absolutely.
Not with hair acupuncture, not with another protocol, and not with any point of the NADA protocol. So, okay. It is sure, simple, and effective. And it is nice and friendly.